For many, the thought of visiting the dentist can feel more stressful than relaxing, but it doesn't have to be. Our next guest specializes in smile makeovers with a focus on making patients feel comfortable every step of the way. Here to tell us about her patient-centered approach is Dr. Andrea Joy Smith from Smile Again Now. Hello, Dr. Smith.
Good morning, Desiree. How are you today?
I'm doing good. So, Dr. Smith, we were kind of hinting a little bit how some people kind of fear the dentist. So, even though some people hesitate when it comes to dental work, how do you and your team make this process more achievable for them?
Yes, believe it or not, a lot of people fear the dentist. In fact, I didn't go to the dentist very much when I grew up, so I really had no idea that patients had the fear that they have. But once I discovered it, I started implementing techniques in my office that would make them more comfortable during the procedure, like sedation dentistry. It's a oral technique where they just take a tablet an hour before the visit. They come in, we get them a little bit more asleep with more medication, and they're able to sail through those visits a lot easier. But the relaxation process actually starts when they first walk in the door. I make it a point not to start looking in their mouths right away. I sort of talk to them, I meet them where they are, and I figure out what it is that brought them in to see me first. And if they have any fears, I do my best to let them know that we
You,
can definitely handle that as well.
you ease them into it. And Dr. Andrea, let's talk bold transformations. How can a smile makeover really help someone truly step into their best self this year?
Yeah, when patients step into their best self, they are confident. And so if they can show their teeth, that they can smile and laugh with confidence, that is a way that they can put their best foot forward. I find that patients that have stayed away from the dentist and have continued to wear masks, even though we're not required to after COVID-19, is those patients that are ashamed of their smile. They really want to make an improvement, but sometimes fear keeps them away, sometimes finances keeps them away, and they're able to come to our office and get that transformation. We allay the fears, and we also make the finances work for them as well.
There we go. And once you calm the fears, let's talk about one of the services you offer, one-piece implants. Who makes a good candidate for a one-piece implant?
Well, patients that need teeth replaced or dentures stabilized make excellent candidates for one piece implants. The procedure is a lot less invasive than conventional implants, and we can put a tooth on the same day. The patient that you're showing there, he came in very, very ashamed of his smile, and we were able to remove the teeth, place the implants, and give him that winning smile that he walks around with now. So we do that with one piece implants. We make the procedure, it's a lot less invasive because it's a one stage surgery. Conventional implantology, although they are very good and they serve their purpose in dentistry. It's a lot more complicated procedure. Normally, it's a two-stage procedure where the implant goes in, stays for a while, and the patient's wearing some type of a temporary denture or something before they can have the restoration placed on top. But with one piece, as with this patient here, she came in one day with a smile that looked with a smile that she was not proud of, and we were able to put in one piece implants and snap in a new appliance that looked very good the same day.
Wow, and you can see how life-changing that is, how transformative it is looking at those before and afters, Dr. Smith. Can you briefly walk us through the process on how one-piece implants are installed?
Absolutely. So the first thing that we do is we start with our diagnosis. The diagnosis is a missing tooth or a broken tooth that we can no longer restore, or it's a loose denture. So once we establish what the patient needs, we then take a CT. It's a cone beam CT that gives us a three-dimensional look at the bone. If we look at the bone around the teeth, we look at the bone that surrounds the teeth, and we're able to determine whether we can put implants in. So for our patients that are fearful and don't want to start that same day, although I have lots of patients that start that same day, we give them a subsequent appointment with medications that they'll take the night before, the morning of, and then they'll come in for their treatment. And for those patients that want to start the same day, they'll come in with a loose denture. We'll take that CT scan. We'll place those implants flaplessly. We do not have to open up the tissue or open up the bone. The implants go in directly through the soft tissue. So that decreases the healing time, because when you're opening up the gums, you're sort of detaching all of the blood supply and healing properties of the tissue to re-nourish the area where the implant's been placed. And so that's usually associated with a lot of post-operative pain or pain after the procedure. Well, when we avoid that step and we go right through the gums, after numbing them up, of course, with local anesthesia, we're able to decrease that healing time and decrease any post-operative pain that they might encounter otherwise.
There we go. Well, I'm going to let our viewers know where they can go if they're interested in one-piece implants. You can smile bright this year and learn more by going to smileagainnow.com.